There are multiple applications of ctDNA, obviously liquid biopsy throughout patient's journey, different application in early stage disease, different application in metastatic disease, and different application for cancer screening, which I won't talk about, is not my area of expertise, obviously. So far, the evidence that pointed towards the most useful in clinical setting is currently just looking for mutations to find a treatment for, what we call genotyping, to help clinicians decide what's the best treatment to give the patient. That's pretty straightforward. I think that data currently suggests that there's very high concordance between what you find in the blood compared to what you find in the tumor. So that's probably the most immediate application. The rest of the application, for example, to track, we know that ctDNA can track cancer burden and their response to treatment very well. But the next step is, can we use the information to change patient management? That are evidence that we don't have at the moment. Is it better than CT scan? Do we need to wait for CT scan to change management, or can we change management based on ctDNA alone in the metastatic disease setting? So those are questions that have not been answered thus far. In terms of the early stage disease setting, we know that having ctDNA in the circulation after curative intent treatment, this could be surgery or this could be chemoradiation, predicts for very poor prognosis. So it's a direct indicator there's still cancer cells left behind after curative intent treatment, and it would guide us as to whether the patient needs more treatment down the track. Adjuvant treatment, so adjuvant chemotherapy is probably the most obvious one. Now we know there's now lots of evidence pointing towards that it's a good prognostic marker, but once again, the next step require randomized clinical trials, comparing a group of patient who's managed as per standard, and then another group of patient managed by using the ctDNA results. That's the evidence that we're waiting for.